Welcome to another session of the 69th Annual Utah History Conference. Just a reminder that this session, along with our other sessions this week, as well as pre-recorded sessions, is being recorded and will be made available on our YouTube channel. You can access the full programming from this week, our conference, through our websites, history.utah.gov or ushs.utah.gov. This morning's session will run until about 1:15 p.m. Mountain Time, so an hour and 15 minutes approximately. Our speakers have agreed to field some questions, so we encourage any questions that you have to be submitted via the Q&A box at the bottom center of your screens. For those of you tuning in to Facebook Live, we're also monitoring those questions that come in through that medium, so you can ask questions there if you'd like. Let me just thank our sponsors for this conference, which are the Utah Division of Arts and Museums, the Utah Department of Cultural and Community Engagement, Utah Humanities, and Utah Westerners. So with that, I'm just going to introduce Farina King. Many of you will know Dr. King. She is an associate professor of history at Northeastern State University and the director of the NSU Center for Indigenous Community Engagement. She is a citizen of the Navajo Nation, and I'll just mention her first book, published by the University of Kansas Press, is The Earth Memory Compass, Diné Landscapes and Education in the 20th Century. Welcome her to this session, the other panelists. Thanks, Farina.
Okay. Yate, CEO. I appreciate Jedediah introducing us in this panel that is focused a lot on contextualizing COVID-19 in Navajo Nation, in Diné, Bikeya. And today I have with me my sister, Heather Tanana, who is an assistant research professor of law at the University of Utah, and Shaje, my father, Dr. Phillip Lee Smith, who is a family and community medicine physician and who has extensive research with public health, worked for over 30 years. He can tell you more, as well as Heather, about themselves and their research, but he worked many years for Indian Health Service and recently has worked with the Sebi in Disguise medical clinic in Monument Valley of the Navajo Nation with Utah Navajo Health there. And so because of these family connections, and even before we started meeting, I joked that there's more in our family, certainly, who can talk about these issues and the historical context of histories of healing and facing disease, illness, and such struggles that we have really seen come to the forefront through the COVID-19 pandemic. But there's series and layers to that history. So in many ways, for me, this is a, as I share, it's a family story. So it's, I feel very honored and privileged, grateful, blessed to be able to meet with Heather and Phil Shaje, as I'll call him, my dad, and talk about this, because as this clip shows, among Navajos, what's really important is knowing your family, knowing your lands, knowing where you come from, kinship. And for me, a lot of my research has been trying to figure out where I'm from. Where are my umbilical cords buried? Where do I have these connections to land as Diné? And I'm chiming in now from Jalagi Cherokee Nation of Oklahoma and the United Kituwa Band of Cherokees in Oklahoma. and in a space with many diverse Native American peoples who came from many places. And I acknowledge them, and I also thank and acknowledge, of course, my fellow panelists, Heather and my father. But it'll be interesting to hear what we all say and share together, because we actually don't have a lot of opportunities to just sit down and have these kind of conversations. So I am constantly learning from my family. They are such important archives and knowledge keepers and bearers. And I say thank you to them with much love. And also acknowledge the many indigenous peoples of Utah, Shoshone, Ute, Paiute, Goshute, who I've been honored to be able to dwell and visit in those spaces where Heather is now, and where my father is, wherever you all are, that I hope we think about, these connections and how important it is of the identity and place and what it means to be Indigenous. So I'm going to start off with providing some historical context and framing, even how this conversation is coming about, because there's a lot of questions that people have had about why the Navajo Nation has been affected in the ways that it has by COVID-19, and especially in 2020, when in the news we heard a lot about devastation and just the horrible disproportionate impacts of COVID-19 on Navajo Nation. And I thought about how Angeline Morningstar, a filmmaker, made a movie right before COVID-19, actually, called Diné. And in that film, she talks about a apocalypse of disease spreading, a pandemic that decimates the world, but she shows it through the lens of Navajo Nation. And in this image that you see here from her film, you see a young Navajo woman who is featured in the story following her, and she's wearing a mask. And to me, it just was quite surreal. This is my family, my cousin's on now, Yate. He let me share this, of my own family wearing masks only within a year later. As you see, my parents, dad there. And so he's been a big part of me trying to understand and make sense of why is this pandemic affecting different peoples in the way that it does, but especially Navajo. And Angeline's film kind of was foreboding. It was like seeing into the future. But what's really powerful from that film is how she traces the resilience and how important Diné identity is in all of that. And that's been really inspiring for me, as Navajos have referred to COVID-19 as a monster. It evokes stories and history that go back beyond even marked time, right? Since time immemorial. And a part of that, referring to Navajo's reference to COVID-19 as a monster, goes to oral histories and oral traditions of the twin heroes and how they fought monsters. And they left a couple of them for us to deal with, including sickness. And so in a lot of ways I saw, and we had heard, all of us have heard, how physicians, like this picture of my dad here, physicians are heroes right now, facing this battle on the front lines. This is the kind of language we're hearing. So it's something certainly relatable among different peoples and cultures. This is an image that my niece, Leah Tiare Smith, did, as I asked her to make some images of my dad. Because when COVID-19 started to break out and there was all this news of how rapidly it was spreading and hurting our relatives in Navajo Nation, I was so, concerned of my father, and also just kept hearing the question, why? And so then I started this part of my website called Diné Doctor Syllabus, which was all about contextualizing the impacts of COVID-19 in Navajo country. So, I encourage you to check that out, because I tried to think about, what are terms we need to understand, what kind of sources, reading materials are already out there, oral histories, different resources. And of course, what my dad and Heather can talk about with their backgrounds in legal and public health fields, is there's all this evidence, of how Navajos are being affected disproportionately and at rates that surpass anyone else. And that's what, these little images refer to as all these kind of data trackers of seeing all these numbers that turn into statistics about how Indigenous peoples are being affected. And not to mention, especially Navajos, where this was from a syllabus that shows you how heavy it is in Navajo country, the impacts of COVID-19. And as we watched all these numbers creep and crawl, and even lost, our own loved ones in this time, including my father's sister, my paternal aunt, we felt this all so close, that these aren't just numbers that we're all, experiencing right now, is these are our loved ones. And so something that Sunny Dooley said to me, not to me, but that it struck me in an article, because there are all these different news reports, stories, people sharing stories, as she said. She also evoked the COVID-19 as a monster and oral traditions in that way, but it's a monster that we as human beings have created to feast on. That was a part of her quote. And I remember, my dad can maybe talk about this too, because a lot of this comes up, and I don't want to take too much more time, because I want to be sure we hear from both Heather and my father's remarkable works and efforts in this area. But I remember as a child, we had a book it was a report, the Navajo Nation and American Colony, a report from the United States Commission on Civil Rights. And that report talked about how, just the language of being a colony and all the disparities in health and accessibility and such. And then we fast forward to 2021, and that report was from the 70s? My dad can clarify. I'm trying to remember off the bat, but it was decades ago, right? And what I realized, even with my father's own story, because I am actually working on a book that I want to interweave how my father is a part of a legacy of Hatafle, ancestral traditional healers among Diné, is back from that picture that I featured. It's one of our family's favorite pictures of my dad when he was in a clinic from 1984. It came from an article from the Deseret News that talked about how living conditions are cutting lives short, and the struggles to even reach families that were in dire need of medical attention and health support, roads that were unsurpassable, and all these different issues. And that was getting to 40 years ago. And then we hear these similar struggles and dynamics with COVID-19, and different stories that even my dad has been featured in the news or talked about. So for me, again, it's really situating these stories in my own family, these very personal stories that help us to get beyond numbers or just thinking, oh, this happened long ago, but these are about our relations, our relationality. And in many ways, I see COVID-19 as a head of a hydra of the impacts of colonialism, especially settler colonialism that has been very extractive. And I know Heather works in areas of environmental law and legal studies. and so many others like Ethel Branch and really excellent, amazing Diné scholars and public intellectuals like Jennifer Nez Dinetdale, a historian who wrote Reclaiming Diné History. All these different, historians and scholars who have noted that this didn't happen out of a vacuum, right? Such as this scholar here. This happened, it was waiting to happen. These areas are not ready. The different struggles that we've been that have been going on, and scholars that see, there's these patterns and histories of extraction, and it affects bodies as well, such as Melanie Yazzi's work. So I can mention, as it's hard in this brief time, but this is why I'm working on a book about this. But there's so many areas, even beginning with time immemorial, of stories of Diné perseverance, that once those twin heroes defeated, yet it's so, they took the metal from his body and created tools to help and support the people. And in the long walk of forced removal, where more than 10,000 Diné had to leave their homes, and over 3,000 died in Alhuete, the land of suffering and the struggle, over 100 years ago, over a century ago. And we think these are so long ago, but they're really not, when they're intertwined with also histories of, as we're hearing about now. And actually my main area of study in many ways is Native American boarding school experiences, and finding unmarked graves of children who did not survive that assimilationist, and also the language of terminationist efforts to eradicate Navajo-ness, to detach Navajos from their homeland. And whether it's seen as absorption or assimilation or whatever it's called, these are all different forms and tactics of controlling a people, colonizing them. And in every way, it goes back to how some people say, well, it's just a disease, it affects people indiscriminately. But what we're finding over and over again is that's not the case. There's clear connections of these histories of human action and human injustices experience that are propagating and worsening these cases. But what is very powerful, and that I'm sure Heather and my father can now talk about, and I'll turn the time to Heather to also relay and share with you, is the hope and the ongoing resiliency, not to take that word for granted. But I think of the Diné cycle, the 4 directions, and that centers on Sa Nagay Bikehajo, which is restoring balance, a constant cycle of seeking balance. And one of the 4th direction is Sihazin, hope. And it's such great hope right now to know that Navajos are leading in the vaccination campaign and value community so much, and elders so much, and have carried those traditions, those values through generations. That's what's really so powerful in these stories. So Heather, thank you. I'll turn the time to her.
Okay, thanks. So, Farina did a really great job of introducing us and providing some background about the harsh impact that COVID-19 has had in many tribal communities, and especially in Navajo Nation. That's kind of their most recent numbers there. And events of the past that she was talking about that contributed to the devastation of tribal communities by COVID. In Indian law, we refer to those as these different eras of federal Indian policies, starting from the Doctrine of Discovery. This is a very classic concept in Indian law, setting up the relationship between the federal government and between tribes, And if you ever have any interest, you can, Google this, the Marshall Trilogy, very long opinions, but, applying kind of what at the time were international principles of law to the situation here in the US to say that tribes were discovered. And so very early on in our legal system and interactions with the federal government and tribes, they're setting up this relationship where tribes are, sure, they're sovereign nations. They have a government to government relationship with the tribe, with the federal government and with states, but that's been limited and continued to be whittled away over time. In the second case of those Marshall Trilogies, that's where this term came out of domestic dependent nations. That, all right, tribes, they are sovereigns, but they are dependent on the federal government for protection of their rights. And, again, this is very, very important history that we could spend the entire hour talking about these events, about these eras and the policies. Farina hit on different actions by the government that were occurring over this time frame of the past 200 years, particularly the boarding school era, right? That there were intentions and policies implemented by the government to assimilate Native people into the mainstream white communities. And I like to, there were certainly some individuals where they did not have good intentions at all. Many of the purposes back in over this time period was to kill and eradicate the Native race, all of the tribes. And then that shifted, and some of these other eras, like our assimilation era, our Indian reorganization, where the goal was to make indigenous people like white people. There were some good intentions during those policy timeframes that some individuals really thought it was for the benefit of tribal communities, that if they were to succeed and be successful, then they needed to kill the Indian to save the man. They needed to become Christian farmers. But there were real harms from those actions. The forced relocations, the boarding school eras, even if we accept this assumption that they were well-intended, they resulted in historical trauma that very much continues today. And, these other categories, boarding schools, I think a lot of us are much more familiar with it because of that, what happened in Canada and Deb Haaland's announcement about a boarding school investigation here in the US. But many people are not aware of involuntary sterilizations that were happening against the consent or sometimes even knowledge of Native women. They're not aware of how energy development has occurred in this country on tribal lands, where the mining contaminated and caused a lot of pollutions into the environment, that Navajo babies born today are having traces of uranium in their blood. And yet all of the benefits of that development, the actual energy itself, the economic gain was often occurring and for the benefit of those off the reservation, right? We also have events in our past that the government promoted, like livestock reduction. So sheep is very important to our Navajo communities. A lot of them, it's their the way their economic livelihood depends on it. And there was an effort by the government to reduce that, just killed a lot of sheep, and that just devastated many families. And so all of these policies, these things that Farina was talking about earlier too, I think it's really important that we acknowledge, one, our federal system set up tribes to go and turn to the federal government to protect their interests, to promote their communities and their futures. And yet at the same time, what history has shown us is that the federal government has failed to do that. And in fact, they've actually taken direct actions contrary to the best interests of tribal communities, and really harmful things that continue today and resulted in the high rates of COVID. Now, just real quick to look at where we are, I think it is very important to still acknowledge and realize that tribes, they are still sovereigns. They retain that inherent authority to protect and promote their welfare. It's good, that power, again, if we had more time or this, I'd go into the different current legal environment of tribes. I think it's sufficient to say that their legal authorities are strongest when they are governing their people on their land, and when they want to exercise or pass laws or govern non-Indians on their land, or even worse, right? We get a very complicated situation because of those past eras where now in some tribal communities, you have trust land that is held in trust by the federal government for tribes. Tribes can't sell that land. But then there's also what we call fee land, where anyone can own that land. So it creates really complicated jurisdictional situations when we look at Indian country. But tribes still have authority, even if it has been diminished. I mean, just look at these maps here in Utah, right? There's the tribes that have historic ancestral ties here, and the map on the right, the orange, those are our reservations here today. I mean, very diminished. And again, Farina mentioned the U.S. Commission on Civil Rights. At the end of 2018, they released a report entitled Broken Promises, talking about all of the shortfalls that the federal government has had with respect to tribal nations. As a result, there's limited health resources. You can hear a lot about those challenges next. I think that Indian Health Service, one of the main providers of healthcare for Native Americans in this country, has historically been underfunded. There are food deserts that exist. The news outlets were reporting that in Navajo Nation, a area that is as large as West Virginia, that there's like 13 grocery stores, right? And what I want to spend the rest of my time really focusing on is water insecurity. There were studies done early on that connected the COVID incidence rates with piped water access coming into homes. If you can't turn on your faucet, right, to frequently wash your house or sanitize, that's going to increase your chance of contracting COVID-19. And then these other areas of housing shortages, just lack of infrastructure, the road conditions, broadband internet, all of those are challenges that many tribal communities, including Navajo Nation, face, but that are directly tied to the past actions of the federal government, or really inactions of the federal government. So just with my last time here, a lot of my work over the past year has focused on water access, specifically in the Colorado River Basin. We have 30 tribes across the Colorado River Basin, and that includes Navajo Nation. And Navajo Nation is, it's estimated that about 30 to 40% of the homes on Navajo Nation do not have piped water service. And there was a study done earlier, I think just this year, COVID, it's like, was it 2021 or 2020? I think it was this year, by the U.S. Water Alliance and Dig Deep. And they found that there's a direct connection between lack of water access, talking about pipe to delivery services, and race. And that Native American households are less likely to have piped water service than any other racial group. Nationwide, they're 19 times less likely to have access to plumbing. And that is, if we want to compare it to other minority groups, Native Americans are almost 12 times less likely than African American and Latinx households to lack water. And so there is a very clear racial component to water access in this country. And yet water, and sanitation systems, they are so integral to public health. I think it was the IHS had estimated that every dollar that's spent on kind of water and sanitation facilities in tribal areas, it has at least a 20-fold return in health benefits. And so if you go to tribalcleanwater.org, you can see the report that we put together with the Water and Tribe Initiative that goes to look beyond purely piped water access challenges, to look at water quality issues, infrastructure, even tribes that have water systems in place. Some of those may be decades, even dating back to the late 1800s. They are outdated and just insufficient to be able to sustain these growing tribal communities. So that's included in there as well. And then this is getting a little more technical, but operation and maintenance support is a real challenge in Indian country as well. And even once you have these systems built, the tribe needs to be able to operate and maintain them into the future. So I encourage you to go to tribalcleanwater.org and look at that report in more detail. In my last 30 seconds here, though, I do want to say that there's been some very promising action by all three branches of government. The McGirt Ruling, if you listen to This Land by Rebecca Nagel, season 1, she covered McGirt and criminal jurisdiction in Indian country. And it was really such a huge case for anyone working on legal issues with tribes for that ruling to come out, because at its core, the US Supreme Court held the government, the federal government, to its promises. And it found that this reservation was still intact for the Muscogee Creek Nation. And I love this quote that Justice Gorsuch said in writing the opinion, that he recognized promises have been made and they've frequently been broken, but unlawful acts performed long enough are not enough to amend the law. And so it was a real, I think, encouraging ruling to show that the future, it is bright. Tribes, they are sovereign nations. They have power that they can utilize. And the actions of President Biden and his presidential memorandum that came out, and some in Congress right now, there's a lot of money being talked about to direct to Indian Health Service, to agencies to fulfill those promises. It just makes me encouraged and optimistic about the future. But I'm going to turn next then to Dr. Smith, who has been very much on the ground during the pandemic, directly interacting with patients and there in the community, so he can give his perspective. Yay.
Good morning. I'm Dr. Smith. I'm also a Navajo. I thought perhaps by way of just introduction, I would just let you take a minute or so to introduce myself from the standpoint of who I am, because I think sometimes in this particular setting in which historical perspectives of things are being discussed, that sometimes our history really directs, what might be described differently by someone who has a different background. For me, so when we talk about these things of the colonies, the Indian Wars, etc., and we see in the movies of the past injustices that have been inflicted on the Native American, it doesn't go very far for us to get that linkage. My father was born in 1896, just about 5.5 years before the last Indian Wars were completed on the plains of the Dakotas. And my grandmother was born in 1866. And so just in a matter of almost a generation of 2 generations takes us back to the 1800s and the period of the Civil War that seems to most people years and years away, that's so ancient that nobody really worries about them anymore, except in the context of some lasting effects from those discussions about race or other things. But in terms of my training, it's in family and community medicine, and I have been working as a family physician on the Navajo reservation for a large part of my career. And so I think what I'm going to do is talk a little about the COVID, impact of the COVID, and what I have seen here and some of the impact on the Navajo people that's here. I think I want to preface my remarks by saying that the Navajo people are very dynamic. We have individuals in our community here in Mitt Valley who never went to school. They do not speak any English, and they're in their 90s. A lot of my patients were in their 80s, and they aren't even aware that 9/11 terrorist attack even happened, and yet they are fully aware of the COVID-19 that they call the big cold number 19, or the Kusensai Nazi. And I think the best way to understand that is to say that Navajos do have a zeal for knowledge and learning, particularly when it pertains to their health. And the social determinants that Heather outlined really does impact the health of the people here. The economics, Justice Department, education, the businesses, and of course, health. Within the health services, we do have, we're not like the health services that you see in the general population, because our hospitals are on the sort of on the periphery of the reservation, though Chinle is more in the middle. But even there, the capacity for the care that's needed for people who need hospitalization from the COVID is limited. So most of our patients that had, the greater impact of respiratory problems related to COVID had to be sent to Phoenix or Albuquerque, Denver, or Salt Lake City. And many were sent to Grand Junction as well because of the need for respiratory support using ventilators and ECMO and other things like that. As Heather noted, we now have 33,450 cases of the COVID, and we do have relatives that were impacted by that. We've had 1,430 deaths, and when you put it in the perspective of our population, it said that we have 3 times the case rate that the rest of the nation have, and 5 times the hospitalization rate. The thing that's very promising is the great support that the tribal leadership has displayed in addressing the public health response to this. They have really partnered with the health facilities, particularly the Indian health service, who've done great work in getting people vaccinated. I think the historical perspective of people coming onto the reservation and being engaged in research has really impacted this in a positive way, particularly Johns Hopkins University. In having it start in the 1988 when they were engaged in the hemp vaccine efficacy trials, the rotavirus vaccine trials, the PCV7 Prevnar pneumococcal vaccine trials, and the RSV monoclonal antibody trials, as well as the COVID-19 efficacy trials that started in 2020. And so people have been very willing to be vaccinated on the reservation as long as the vaccine is available. And through the support of the federal government, we've been able to get access to the vaccine, the Pfizer biotech vaccine, the Moderna, and Johnson & Johnson. Our clinics that are on the northern part of the reservation have mainly used the Pfizer vaccine because CDC and the state of Utah have been providing the vaccine to our clinics. We have 5 clinics in this area: Navajo Mountain, Monument Valley, Montezuma Creek, Blanding, and we service a lot of the people on the northern part of the reservation. We've had a lot of cases of the vaccine, of the virus, and the thing that I think that I've seen a lot is the things that Heather and Farina talked about, particularly in Monument Valley and the northern part of the reservation, where a lot of people relied on the tourism industry for their work. These were seasonal works with tourists that came in from Europe, from Asia, and they would spend lots of money, and people would work during the summer and fall months and really provide enough funding for the year for their family. And when everything shut down, all of a sudden the unemployment rate went sky high. And I think the thing that has been very difficult for people to understand is that people are living in really close quarters with multi-generational families living within a real close proximity with each other. So that if one person gets the COVID, it's oftentimes spread very quickly through the rest of the family. We've been very lucky in the sense that we've not seen any children's deaths. Most of the deaths have occurred among the elderly. And the things that Heather mentioned with uranium mining, we had a lot of mining here in our neck of the woods in Monument Valley with the VCA area and Mexican Hat area. And so a lot of my patients who had those, the impact of the pulmonary problems related to exposure to uranium, most of them have, if they got the COVID, most of them succumb to the infection because they already had underlying disease. I think for me personally, I've had about 18 of my patients who have died, and I live in a very, very small community, and most of those patients were those who were 75 and older. And one of the things that sometimes we don't worry about it from the health perspective is we tend to worry about people's physical conditions, things we can measure, things we can, when we take the blood that we can see, and we focus so totally on the physical that we forget there's a real emotional compact, a social compact impact on the health and on the mental health impact, because what we see in a lot of the family is guilt, because usually the person who had the infection had gone to Phoenix for a concert or Las Vegas, driven there, and came home and then interacted with the family and then infected, the grandparents and who succumbed to disease when they got it. We have been very fortunate in the support of the outlying communities who have been willing to take our patients to when they've needed the really intensive care. I think as we look at things, I think all I can say is that the Navajo culture, as it is, really does have an impact on the healing that's taking place. And one of the things that makes that happen is the women. We are in a matriarchal society, even though we've had some changes, is that the women have really stepped forward in directing their families to get vaccinated, and the men just go right along with everything, and they're the ones who have kept their house clean, and when they've been quarantined, the women have made sure that things were followed according to the dictates. Just in closing, maybe just saying a couple of things relating to the traditional healing practices. The IHS, along with a number of health organizations and the support that have come through, have provided guidance on how to go and continue those traditional practices of, having sweats and having ceremonies by giving directions on how they could still do it and have these ceremonies without causing the spread by distancing, limiting the number of people who come to the ceremonies, focusing on isolated type of ceremonies performed, and that has really impacted the overall health of the people, because the Medicine Men and the Association have been supportive of the vaccination program and have provided great support in giving directions to follow the direction of the public health assessment. I think here on the ground level, we have really been greatly impacted by the COVID in terms of having funding within the family, in terms of having access to travel, having a sense of, in many cases, of hopelessness when people have been infected, and the isolation that occurs when people are hospitalized hundreds of miles away with no contact with family, and it's because of the infrastructure that we have with roads and the lack of the internet access. Sometimes it makes it difficult where people in the city and the rest of the state have interface with cell phones and Zoom and everything like that. Many of the people on the mid part of the reservation have had problems with that. Suffice it to say is that from the clinic staff, we've been grateful for the support that the state of Utah has given us. We've been grateful for the support that CDC and the IHS and the federal government have given us. And I think that it is mainly through the public health effort that we have been able to get a little on top of the pandemic. And we have been very restrictive in terms of the travel here being shut down, even though the state of Arizona, New Mexico, Utah, and Arizona have opened their business again. We have on the reservation have kept it in the code orange level and minimizing, flow of people into the communities and out of the communities, and limiting the number of meetings that with large groups of people, even including religious gatherings, ceremonies, and that sort. And I think that has minimized the spread and really curtailed the number of deaths that we have experienced here on the reservation. And suffice it to say, we do feel it has been a monster, but it's something that we can control. And we truly believe that vaccination is the key for us to do this. And the public health setting of sanitation but we're hindered by the lack of water. We're in a drought in this area and greatly impacted there. And I think all you need to do is read the reports of Lake Powell being at about 30% of capacity now. All the water levels have really decreased. When you see and drive on the reservation right now, you see the impact of the vegetation dying because of that. And with that, let me close, and turn it back to Farina, Dr. King, to give concluding remarks.
Oh, yeah, thank you, Dad. As I said, a lot of my passion and love for history stems from my father and my family. And so I just always learn a lot. And, the slide I didn't get to, one of them was back in 2020, I interviewed my dad and I talked to him a lot. and it was in spring of 2020, and I was asking him, what do you want people to remember of COVID-19? And something he said that stuck out to me was, when you're healthy, there is harmony and good balance of things. And that was Dad's probably gonna think, why that picture? But a lot of wonderful experiences and thoughts of it is, as my father shared, he comes from a background of his own father being Hatafle, and thinking about healing from a young age. And he also has lived a lot of these different histories we're talking about, including going to a boarding school from a young age, and thinking about ceremony and healing from a young age, and seeing it, even hearing about those sterilization campaigns and those struggles, and working with IHS in these various areas. So it's really insightful and appreciated to hear from him. And Shade, my older sister, Heather, and all that she's been learning about the significance of water in all this. And as I have my cousin here too, he said something that made me think a lot lately. Is he posted this on Facebook, is even though a lot of folks don't have struggles accessing online, it's amazing the extent that they also do. And so the stories people have shared of my cousin saying, in order to survive, I must want to survive. Although that bliss, that happiness, that glory, that unique energy, that fulfillment lasts but a flicker of an eyelid, it is worth fighting to feel. And I know that so many people have done so much through all these different times. There's always been these different Diné healers and heroes, everyday heroes. And I think of Tiana Big Horse, and a Navajo classic published many years ago actually, of Big Horse the Warrior. And his story, that something he said, he told his daughter, was, he said, to Diné, a warrior is someone who cares for the sick and serves the people. Those were a big part of the elements of the character of what makes a warrior. And he said a warrior also brings people together and reminds them their family. And it's emotional and really powerful. And I know Tyson had a question that I think relates to this, of that I'll get to here in a second. But I wanted to say that something both of them did not share, for instance, is Heather was a part of a big movement of seeking donations and working with a group of lawyers in northern Utah, and collaborating with pilots who would do Christmas present drop-offs. And she fundraised and brought a lot of donations to Navajo Nation, to areas that really needed them. And my parents also pitching in, in their free time, whatever time they could, to take those different donations and be there for families that needed it. So those are just two of such examples that I'm really honored to know. Tyson, I'll get to your question because I think it's a really important one. Tyson said, you all have been so very active in all aspects of the pandemic, from healthcare to academics. How have you been able to keep yourselves emotionally and physically healthy, as many seem to have reached breaking points? What advice would you recommend to other professionals and essential workers as to how to stay afloat and balanced health-wise? Thoughts on that, Heather or Dad? That's me.
I think I'll jump in first. I think for me, having a real strong spiritual base really helps, because within that setting, it makes you do things in terms of your behavior that impacts on the life, so that you keep yourself healthy, you keep yourself thinking positively, you keep yourself making sure that you don't partake of things that affect your body. And if there's anything good, you seek after those things, and you rely on people that you trust, and you have that ethos, I think is what I would call it, that lets you know on whom you can trust. And so, I trust CDC, I trust the World Health Organization, I trust the studies that are done very, very effectively, where they have, the power that's needed, and they use the appropriate tests to determine if something is efficacious, and then share that information and do it first. So, if you're going to tell people to be vaccinated, you get vaccinated first, and you vaccinate your family. If you're going to tell people to wear a mask, you wear a mask. If you tell people to wash their hands and to use the cleaners, you do it first, and you do everything that you tell the people to do first. And I think that's what keeps you healthy, because you don't want to share information that sounds, like a fad or just a flash in the pan type of activity, but something that has a basis of good knowledge, of good testing, of good experience, that shows that it's efficacious and effective, and you can't go wrong in that.
Yeah. The past year and a half, if you were working in public health, medical field, or anything really with Indian country, I think you were really busy. And that was certainly the case for me. It's been a very, very busy year with my work with the water access, environmental issues for tribes, and how their sovereign authorities and public health issues. It's been very busy for me. And like Farina mentioned, though, on top of that, we were organizing some donation and relief efforts. But the work itself has been very healing for me. I'm going to get emotional, because when the pandemic happened, it illuminated for me all of the things I had taken advantage of. I just assumed I could go and visit my family anytime I wanted on the res. And then the borders were shut. And you started to hear how your family wasn't doing very well. And then in our case, how we lost people. And so here I was stuck in Salt Lake, and I couldn't visit my family. I couldn't see them or help. And so for me, it was turning to my work of what I could do. So we started the Utah Tribal Relief Foundation to help not just Navajo, but all of Utah tribes. We sent elder boxes to Ute Mountain Ute, to Paiute, just wherever we could. And the response that we had from our Utah community here, not just our legal field, but others, was astounding. And that's what brought me joy through this, was that I was trying to do what I could, and just seeing that other people cared as well about strangers. They didn't have family down on Navajo or out on the other tribal communities, but they cared. And so I think finding value in the work that you do is really important. And then just taking that time to reflect on, oh my gosh, what did I take for advantage this past year, and making sure that you value that going forward when you're able to see your family again and you're able to do the things that you couldn't do.
This was another image that when I was referring to, that hope and Sis has seen, of also teachings to greet the sun every day among Diné, and just a lot of that positivity of community coming together. Something I didn't come back around to that your question made me think about, though I refer to it in some ways, is in that film of Yat Eh Abine by Angeline Morningstar, or Morningstar Angeline. I think I might be mixing up the name, but there was a part where she is talking with her father who dies from the pandemic, and she says, basically says to him, what do I do? You know, how do I get by? How do I survive? I want your medicine. You know, she kept saying to him, like, your Diné be'azeh, I want your medicine. And he told her and turned to her and said, your my medicine, you know, you can't have that. It's in you, you know, the medicine is in you. And something about that just made me think about it. And what Heather said is, you know, it's through our communities and these different generations. My family would gather for reunions in the summer, and we haven't been able to do that for these couple of years, like many people who are living through this pandemic. And it's so hard, you know, to be away from our loved ones. But what Heather just said reminded me of that quote from the film, and also this point is the ingenuity and just how amazing people are with sustaining connections through such difficult challenges. And I see that in history, you know, as I'm learning about simple things like my Uncle Albert. I had a picture of at the beginning with that image of a sunset, and had explained, you know, you ask in Navajo traditionally, where did you bury your umbilical cords? And he was one of the first to teach me about my clans. And one of the stories that he told me that I never forget about, and I wrote about it in my book, first book, was he said how when he wasn't allowed to speak Navajo at school, and he was punished for that, he would talk to sticks and rocks. And it's just, to me, you know, how even a child in such a difficult situation, they they maneuver, they figure, they navigate so much. Though I'm not justifying or accepting that was something that should have been or whatever, but I'm just astounded. And something I've learned from this pandemic is there were some individuals, when, you know, the lack of running water and those kind of issues, there's some Diné on the ground, you know, in town, in their communities, who made this portable hand washing device out of like a bucket and all these amazing things that I was reading about. And they were getting sponsors from Home Depot and just connecting with people. And then there were people in Ireland donating because of connections they felt with how the Choctaw contributed to Irish people, supported them during the Irish potato famine. And so it's just amazing how history and these intergenerational ties can really remind people of a central teaching of Diné is we are humanity, recognizing that we are five-fingered beings, and seeing that humanity and relationality in all things around us. So I just thought that was really powerful. I don't know if we have any other questions. Thank you. Thanks, Tyson, for your comment there. And we're so grateful for you. But I had a question as a follow-up, but because we still have about 10 minutes, is a lot of the points that Heather and Dr. Smith dad said is brings up trust issues. Even right now, my father's emphasis on trusting the CDC, and, you know, this is a current climate and context as well of what sources do you trust and all those kind of conversations. But even thinking about historically, I mean, the 1918 pandemic, for example, was as much, even arguably more devastating, in the world, and certainly affected Navajo Nation and the different stories there and lived experiences there. And something in my studies of reading about that, or these different issues, including uranium mining that both of you referred to, other questions that are coming up about energy, for example, and the Gold King wastewater spill of 2015, that wasn't too long ago. And in the area where my father's from, 1979, the Church Rock uranium mill spill. Though, these are all these different experiences. What Heather also mentions with, and my father, what it reminded me of is there's this ongoing tension of, do you trust the government or not with your health and well-being of, the Navajo Nation? And how do you gauge that when there's a lot of very messy history of the breach of trust, and then how do we now face that history or move forward knowing that history? Does that make sense? That's some thought that I wanted to ask you both about.
Heather, do you want to say anything first? Because I have some thoughts.
Well, I'll let you go, but the one thing I'll emphasize is, again, when we're talking about Native Americans in this country, it's just so important to remember that it's not just this racial classification, but it is very much a political one. And so this breach of trust, I think, is the whole discussion is even more significant for Native people in this country, because the federal government has a legal responsibility to tribes, to Native Americans in the US. And so when those are broken, it's not just like, oh, well, the government failed us. It's just like this higher federal government. It's like, no, they failed us in our these very long history negotiations, for the land and loss, and they haven't upheld their end of the deal. It's actually like a contractual obligation that they've broken. So I'll just throw that out there and then let you go.
I think just more on the practical side of things, and maybe just limit this to the health perspective. And this is more of probably my opinion than maybe be factual, but it's what I have observed while I've been working on the reservation on and off through the last 35 years as a health provider. But what I see is that trust develops when there is continuity of care, when you have a provider that has been there for an extended period of time, who is willing to come into the community and stay. And trust is decreased if somebody just sort of pops in and out. And this has been the problem with a lot of health providers who come to the Indian health system, which is like the Indian IHS hospitals or the tribal clinics or whatever. In those areas where trust is high, the physicians, the nurses, the physical therapists, and all of the supporting cast that provide, a team approach to care, if they have been there a long time, the trust level is really high. But if the attrition rate is really low, which has tended to be the case in the past, where you see locum tenens come in and go, the trust is really low. I think I know that because of the pandemic, the issues of getting care, especially if it's elective, has been really delayed during these periods of time. And a lot of times people only talk about the medical care that's delivered and forget about dental care, forget about mental health. And those areas, the delay has really been devastating to many people. Like, for example, just getting a dental appointment in the IHS in Kayenta is about 6 months. And so if you have an acute condition, sometimes the response that's to address the dental care is just to remove the tooth rather than repair it. especially if you need root canals or whatever. And so as a result, you're going around the neighborhood and you see 20-year-olds, 30-year-olds losing the majority of their teeth. And you don't see that in Salt Lake City or Provo or St. George, where you see the bright, shining white teeth of the young, middle-aged, even the elderly. And particularly in mental health issues, I'd like to, also say is that, in terms of doing research on the Indian communities, it's sometimes very difficult to do this. Now, I think one of the things that has been very difficult is, the reports that come out nationally from NIH and CDC, EPA, and the federal government, oftentimes give statistics about health or any type of things, and you find very limited data on American Indian Alaska Natives. First of all, the power is oftentimes difficult to see that when you're doing the biometrics evaluations, they don't oftentimes meet the power, so you can't really publish anything. And so as a result, sometimes you don't have the data that sometimes you want to share with the community, because the community is very small, and so it's and people want that data to develop that trust, and the only way to share that information is somebody who remains in that setting. I do think that, as I alluded earlier, is because of the exposure of some organization, and I oftentimes think of John Hopkins, who has been on the reservation since the 1990s and has stayed, and they see these people. The trust element has gone, and that's how they were able to get through the IRB process with an efficacy trial, which is next to impossible for some other health organization to come in and try and do through the Navajo IRB because of the trust issue. I think the trust issue is a little different than what you're seeing with the general US population, where it seems like it's along political lines. At least that's what the media reports. I don't know if it's true or not, because these are oftentimes small surveys done in certain states. And so if you happen to go in a blue state, your data is a little different than when you go into a red state. And so the issue about trust oftentimes is political. It's oftentimes race. It's the isms of the world that come into play. And on the reservation, it's more of just remembering the past, and say, will they do it to us again? And if they don't do that, then the trust element goes up. But when you are sick, you sometimes get desperate and you'll go to anyone to seek care, as demonstrated by multiple articles that come in the journals relating to where do people get their care. And I think people forget that oftentimes the data that we see on health is mainly related to hospitalized patients and oftentimes not community studies. And you find on the reservation, not too many people go in for preventive annual exams. And so when these pandemics hit and we tell people to come get vaccinated, we see that they have not even had their basic tetanus shot, or having their boosters for the DTaP, or having their shingles vaccination, because they never bothered to come in. And but when you go into settings like the school where they're required, then you see the vaccination rate in the high 90% for children that are entering school or getting into the Head Start program in that area. And the problem is later, as they get into their 20s and 30s, they don't get the boosters that is sometimes recommended unless they have an emergent or urgent condition. I still think that, there's still a mistrust of the majority of the Native people about government because of what has happened in the past. but yet they have no other options. So they oftentimes have to get a little desperate and then try and trust and hope that what people say they will do or what they will give really does come through.
Thank you for those points. Something that you both said also reminds me that it's not always in terms of Navajo Nation or Diné people and the U.S. federal government, that there's these senses of distrust and tension that kind of is this messy dance, if you will, but also acknowledging non-Diné communities, white settler communities, or non-governmental entities that also affect these various dynamics and histories. For example, in Utah, what historians have referred to as Indian wars, but even there's some question of those kind of frameworks. Ned Blackhawk's work, for example, of violence over the land, that, what's been called a war, what's been called a battle when they are massacres or different other dynamics, the terms we use and effect. So it was a history of the so-called Posey's War, right? And it was called a war in San Juan, what is now San Juan County, and struggles and tensions over land and Paiutes and Utes being removed and even incarcerated in a prison camp in the early 20th century. This certainly wasn't long ago. And it leaves its imprint and entangles with even tensions and arguments over Bears Ears or these different dynamics today, and what sense of healing. I think trust is a big part of community healing, of how do people live in harmony, live in respect of each other. And yet these histories are something many people are not confronting or sensing it in a whole, from only one perspective or lens that is still very restrictive. So that's something I just wanted to add about that came to mind from your points, is that it's not only between government and Navajo Nation, but also a government that has been fueled by some non-governmental entities and groups, especially of non-Diné white settler backgrounds, for example. Jed, you had a question?
I do. I know that we're running a bit over, so if you don't mind, just two or three more minutes.
Oh, thank you.
I really appreciate this conversation that you're having about trust, because I'm really struck by the close-knit family and community structures that have allowed so many of you to weather and survive this pandemic and this crisis. And I'm wondering, to what extent do you find that the COVID-19 pandemic has frayed in any way or strengthened the bonds within your own community? Not just trust between the government and the Navajo Nation and trust between the outside community groups and the nation, but also within the nation. Are you finding that the legacy of this crisis that we're all going through will actually strengthen community bonds, or will it have another unfortunate legacy? And that would be for either of any of you on this call.
Thank you for that question. Heather or Dad, do you want to go first?
I think in Monument Valley and the northern part of the reservation, is what I've observed, is that there has been a strengthening because what usually happened was somebody got the COVID, came home, and sort of spread it to the rest of the family. So they were sort of in it all together, and they were willing to help one another. And as Farina alluded to earlier, is that when they saw a neighbor who needed something, needed some wood for fuel, or some water for their livestock, or and they couldn't leave the quarantine. Some, others would pitch in and help. There was a real outpouring of community support and a willingness to share what people had, and a willingness to do it under the guidelines that we as public health workers recommended. And so they would leave like the food outside the doorstep and would feed the livestock for them. I saw a real binding. Where I saw a little fraying is where if somebody felt like a young person came home and brought the COVID and caused their grandparents to die, I see a little fraying there where that person was sort of banned from the family for a period of time, especially if they were told not to go down, not to leave, if they were told to stay, away from those areas where, there were reports of, outbreaks in the Maricopa County and in the Phoenix area. And we had a lot of young people go down there to try and go to a concert or go to eat out. And I know of two families that did that, and they were young, in their 20s, drove down there and came back and then developed some mild symptoms, of coughing and having a fever and not tasting anything, and tested positive, and then went to visit their grandparents, and both their grandparents died. And the rest of the family were really upset at that person and said, we want you to stay away for a while until you get vaccinated and your test is negative. And it's almost like banning them from the community for a period of time until they could show that, they were protecting themselves to protect others.
Heather, did you want to add anything to that?
Yeah, I'll just add that I think something that's been really exciting recently is we're just seeing like this rejuvenation or reclaiming of Native identity and culture. And so there's a huge youth movement or younger generation movement. And I think they help to take control of kind of the narrative around COVID in Indian country with contributing to posters and artwork and messaging in communities about keeping your family safe. And so that kind of like assumption of that role, I think also has made communities stronger and closer. And we're just seeing that being led by a lot of the younger generations.
Yeah, I think, it's interesting how so much has that like two-face, especially in history, as I tell my students, change and continuity, constantly in a flux. And what we were talking about, trust and distrust, and then bonding and some tension there, and separation, even if it's temporarily. But something I wanted to share to wrap up with, because I know we got to end here, is let's see if it'll let me. Can you see that? Maybe you see on the side, and I can get it bigger here. So this is on my website of Diné Doctor History, and I've tried to gather stories that were shared over the years of the pandemic. And one that just came to mind from Jed's question was this story of a little girl, and they shared this on Twitter, as you see here, and Instagram, of little Stella, who I think was even paralyzed from COVID-19, and she lost her father, who was one of the victims of COVID-19, over 1,000 Diné who passed on. And what they said about her is just, as you read here, she tells everyone she loves them. And there's this little video here. I'm not going to play it, but it's so powerful. of, I'm not there. I don't know this young girl. And sadly, you know, I got a text, I have small children, and we hear about TikTok and kids having a trend to go and destroy stuff and steal from school. Well, there's also that balance of the negativity with the positivity, that we can use these tools to spread love, harmony, and support. And this young Diné, she did that. So I'm really grateful to hear this story, and hope and really say this, hope and wish everyone well and the best during this time, as it is very difficult. And hope that we continue to seek, you know, these positivities. But I also realize that, as I was sharing, sometimes we also need to unpack, you know, these dark and sad and difficult histories as well, that remind us how much we need to learn and understand, you know, these contexts. And that's where, you know, I think this panel and a lot of this conversation stemmed from, is people not even understanding these complicated histories. And, you know, we heard in the news in 2020 how a man went into Page and was shooting Navajos, or threatening to. He didn't, but he threatened to, because he was scared they all had COVID. You know, there's just how harmful misunderstandings can be. And that's why I'm really grateful for this conversation, and hope that people continue to learn. There's so many more stories and so much to learn from, and different perspectives. Yeah, thank you.
Farina and Heather and Phil, on behalf of everyone listening, thank you so much for being vulnerable with us, for teaching us and helping us to understand and to feel these powerful personal, family, community stories. So it's been really valuable and much appreciated. Thanks, and all the best to you.
Thank you.
Thank you. Take care.
Thank you. Goodbye.
I'll just jump off then. See ya.
Okay. Thank you so much.